Paul in Beaumont, Texas. It says here you're a right-wing troll. What do you want to troll me about? Troll.
No, actually, I love listening to both sides. Okay, I'm kind of like a centrist.
Yeah, I've heard that before.
Okay. No. Honestly,
I'm with Jim Hightower. Okay. The only thing in the middle of the road are dead armadillos and yellow stripes. But so you're a guy who doesn't like to take a position on things. What are you calling about?
No. Here's my point. Okay, you say Canada has such a great healthcare system. They got 37 million people. Denmark's got 5.7 million people. Sweden's got 9.9 billion. We got 327 million people here.
Paul, all of Europe has over 800 million people. And all of Europe has health care for everybody. You will not find one single medical bankruptcy in Europe. None. You will not find a single medical bankruptcy in Canada. None. You will find 600,000 of them last year in the United States. And you and other I don't know how to characterize you. I don't understand why you would think that it's a good idea that Dollar Bill McGuire and Stephen J. Hemsley, the last two CEOs of United Healthcare, should both each take over $1 billion of your healthcare dollars so that they can have 7 mansions, so that Hemsley can have 7 mansions in different countries in the world out of your healthcare dollars. We spend 19% of our GDP on healthcare. The rest of the world, Canada, Europe, they spend around 9% of their GDP on healthcare. I don't understand why you and other Republicans think that we should continue to subsidize a parasitic industry.
That's not what I'm saying. What I want to know, honestly, I wasn't for Obamacare. My wife's on it. Okay, I'm self-employed. Okay, is what it is. Kind of changed my views on it. Okay, honestly, like I said, I just want to know how this can be sustained long term. Because how much is a gallon of gas in Canada? We're talking 37 million people.
Paul, how long ago was 1887?
A while back.
Yeah, about 140 years maybe, something like that.
Yeah.
That's when Germany first put into place the world's first single-payer national health care system. Okay. So you ask how long can it be sustained? Well, so far we know it can run for 140 years.
Germany. I'm talking about here in America.
Paul, you don't think that we're as smart as the Germans?
I want to. What I'm saying
is it that we're too stupid to do it?
Canada ranks 24th in the world.
In what?
Healthcare.
They rank above us. They have a longer lifespan than we do, both men and women. They have a lower infant mortality rate. The fewer children die in childbirth. Fewer mothers die in childbirth in Canada. They have better cure rates for virtually every disease in Canada than we have here in the United States. There are no medical bankruptcies in that country. You can go to college and not end up, in debt that you can't get married or raise a family or buy a house in Canada. What are you saying, that Americans are just too stupid to do it? I don't get it. I realize watching a Trump rally, you might think that, but I'm actually somebody who thinks Americans are as smart as Canadians.
I think we're smarter than Canadians.
Okay, then why can't we do this?
Because the population is so different. And
what is different about our population? Europe is 800 million people. Canada is 37 million people. The United States is 300 million people. What is the difference?
300 million people
versus Europe's 800 million.
Okay. Like I said, I just want to know what's the cost going to be to us, and how sustainable is this?
It'll be less than we're paying now.
Because I know in Canada, a gallon of gas is what, $6-7?
I have no idea what a gallon of gas is in Canada, and that has nothing to do with health care, Paul. The question is why when a health insurance company handles your health care dollars, they skim 20% off the top. They used to take 25 and 30%. Obamacare limits them to 20%. So they're taking 20% off the top to pay for, all of their expenses and all the CEO's salaries. United Healthcare has over 100 people making over $1 million a year, just one company. And they're skimming this money off the top so that they can get rich and so they can pay dividends to their investors. For what purpose?
I'm totally all for everybody getting health care.
You know what the overhead is for Medicare?
I just
Paul,
want to
no,
know
serious
how
question.
it's
Do you
gonna be
know what the
sustainable.
I just told you the overhead for health insurance companies is 20%. The Albert Einstein Hospital in New York City has about the exact same number of beds as, I'm forgetting the name of it, it's St. Somebody or other's hospital in Toronto, Canada, right? There's two hospitals that are almost identical in size, number of beds, number of patients. The hospital in New York City has an entire floor with over 100 people working in it doing billing because of the insurance companies. In Canada, the hospital has one office with 2 employees that do the billing.
Red tape. It's got way too much red tape.
It's not red
Okay.
tape. It's a scam. They're skimming. They're taking our money. So
Right.
I
Yeah,
asked
they're
you if you know
charging
the
extra.
overhead of Medicare. I'll tell you what it is. It's 3%. Medicare runs on 3%, and that includes everything. That's the buildings and everything. If you take just the personnel part of Medicare, because the buildings are all federally owned, it's about 1.5%. So we can run health, and that's, by the way, is what the overhead is in Canada. That's what the overhead is in Germany. It's what it is in France. It's what it is in Sweden. It's 1.5% to 3%. But here in the United States, our overhead, which includes corporate profit and everything, is 20%. We are not paying that for any good reason. We're only paying that because those billionaires that 20% is making rich hire lobbyists who buy politicians, mostly Republican politicians who keep this kind of absurdity in place.
The same thing with pharmaceuticals. You know, we're kind of on the same page. Okay, well, I'm not against health care for people. Okay, I don't think people realize though the cost is going to be associated with this.
It's going to go down. If we went to Medicare for all, the costs would go down.
I mean, what you're going to pay daily,
The cost would go down.
Grocery store, when you go to the gas station.
Paul, I strongly encourage, the cost of healthcare has absolutely nothing to do with the cost of gasoline. You know, Toyota was going to build a car factory in northern Indiana or northern Ohio, and they decided at the last minute to build it in Canada instead because there's $2,600 worth of health insurance in a car. And they wanted to build them in Canada instead. So all the jobs went to Canada. I mean, a national health insurance plan, with a national health insurance plan, a single-payer health insurance plan, I wouldn't have to pay, workman's compensation insurance because everybody gets compensated if they get injured because everybody has insurance. I mean, we wouldn't have to have Medicare, Medicaid, and 16 different programs. We could have everybody covered, and it would cost less money. That's the thing. The Koch brothers funded a study, and they found it would cost trillions less to have national health care.